Well, good evening. Thank you for coming out on a pretty wet and soggy evening, and it's a pleasure to greet you and also greet those who may be watching on our YouTube channel this evening. So I'd like to express our thanks to the panelists that you'll be hearing from in a little while and our featured speaker, and also to the Ames City Council for their support of this initiative, and it's a very important one. Over the past couple of years, I've become increasingly aware of a developing crisis in our community. It's growing in our K-12 schools, on the Iowa State campus, in our neighborhoods, and in the community at large. As we all can appreciate, it's been exacerbated by COVID, due in part to isolation, reduced or cessation of in-person activities, and apprehension about contracting the virus. Additionally, events at the state and national levels have further aggravated it. And the results of it are at times hidden from public view, frequently not talked about, and or viewed as a stigma. What is this crisis? It's mental health. It's the mental health of our children, college students, and adults. They might be family members, friends, neighbors. In other words, our community. Here are just a few sobering and eye-opening statistics. The recently completed 2020 Story County Community Needs Assessment revealed that the top 6 county-wide prioritized needs are: first, mental health; second, food security; third, housing; fourth, childcare; fifth, suicide prevention; and sixth, income. So 2 of the top 6 have to do with mental health, and the remaining 4 are likely contributing factors. According to the Robert Woods Johnson County Health Rankings in Story County, for every 490 residents, there's 1 mental health provider. And this one is really gut-wrenching. The most recent Iowa Youth Survey, completed in 2018, which was taken by 6th, 8th, and 11th grade students, revealed that in the previous 12 months, 21% of those who were surveyed not only had thought about suicide, but they had a plan on how to kill themselves. The highest percentage of those with a suicide plan, 11th grade females, at an astounding 38%. The purpose of tonight's forum is to, first of all, educate. That is, to bring awareness about the mental health situation in Ames. Secondly, assist those in need by identifying existing community mental health resources. And third, to offer hope and an equipping opportunity. And we're going to share with you an exciting, participative mental health first aid training opportunity. Tonight's forum is really just the beginning. Tonight we have the Mental Health, Wellness, Recovery, and Resiliency Initiative. This summer, we're going to be offering mental health first aid and suicide prevention awareness trainings. And this fall, we have a mental health expo, as well as other mental health events. It's now my pleasure to introduce Julie Saxton. She is a probably behind-the-scenes individual, but I've come to greatly appreciate her skills. She's a mental health advocate on the Ames Police Department, and she is a very busy individual, and it's my pleasure to introduce her, and she's going to go ahead and continue on with the presentation.
Thank you, Mayor. Good evening. Thank you again for being here this evening. We are all very passionate about mental health and bringing awareness and breaking down the stigma, and we hope that you learn a lot this evening. I'd like to introduce our keynote speaker, Jason Haglund. Haglund is a 5th-generation Iowa farmer and co-owns the Boone County-based Hickory Grove Family Farm. As owner of Haglund Consulting, LLC, Jason provides behavioral health subject matter expertise and executive coaching based in Story City. Through this pursuit, he develops and delivers guidance, system design consultation, and educational trainings on suicide prevention, mental illness, addiction, behavioral health policy, crisis disaster management, stigma, and stress. Jason is an accomplished senior executive, is also leading a specialty team at the Iowa Department of Human Services, implementing the FEMA Crisis Counseling Program disaster response to the pandemic and derecho of 2020. This project draws upon in-depth expertise of the state behavioral healthcare system, mental health literacy, change management, and his deep agricultural roots. Haglund believes engaging in conversations about the emotional impact experienced by many is an opportunity to discover unknown sources of resilience. Please welcome Jason Haglund.
Thank you very much, Julie, and thank you, Mayor, for having me here tonight. Can you believe you brought a farmer in to talk to you all about mental health? Can you believe that? What does a farmer know about mental health? Now, I kind of start this out with, I've been out traveling, talking to folks. What's the last thing people want to talk about right now? COVID, right? So let's just talk about Recovery Iowa, okay? What's been happening? What's the conversations that you've been hearing, that we've been having right now? You know, there's been a lot of conversations. We've been talking about, what do we do now? You know, what are the next steps? What do I say? What do I do? How many people don't know how to act in public right now? I see hands going up. Is that stressful sometimes? Yeah, sometimes we're questioning things. Like, what do I do? How do I do it? How do I unpack all of this emotion that I've been experiencing for the last 15 months? These are questions I'm hearing a lot. And it's not just a pandemic, right? What other things have we experienced stress in? There's no other screen, so I don't know what the slide says behind me. Wow. I may have to glance back and forth now and then. Right? There's been the pandemic, we know that. We know there's been social and racial unrest that's caused significant stress and anxiety for many. Financial stressors have plagued individuals across the state of Iowa and right here in the city of Ames. Family, have we been worried about family? Have we been worried about grandparents, great-grandparents? Have we been worried about families' welfare? And now, there's a new word. Who's heard of re-entry anxiety? What is re-entry anxiety? This could be interactive, right? We're not all on mute. Right, how do we go back to some of the things that we used to just do that were second nature? And amongst all these compounding stressors, how many people still have to go to work and juggle all of that stuff, right? And when people are at work, 98% of people say their workplace stress affects their mental health. Let me say that again. Of people who feel emotionally drained from their work, 98% of them say that their workplace affects their mental health and their stress level and their functioning. Is that huge? What does that mean for workplaces? What does that mean if you're a supervisor or you own a business or you manage a company? Is workplace mental health important? Is it the most important thing you should be thinking about right now? 100% of the time. So after hearing all of that, how are you doing? I see some hand motions, right? When was the last time somebody looked at you and said, "How are you doing?" When was the last time you answered honestly? How many people here say fine? What does that mean when you say fine? Don't say the real one.
Freaked out, insecure, neurotic, and emotional.
Freaked out, insecure, naughty, and emotional, right? Means I'm not okay. And it's hard right now to stop and take the time to be there with someone, right? I know I've struggled sometimes being able to do that as people are dinging into the Zoom meeting. And you just quick say, hey, how you doing? All right, we'll get started in a minute. It's hard right now. We've all been experiencing this thing, a shared disaster, right? What is a disaster? What kind of disasters are we used to? Tornadoes, floods. Have you ever been stuck inside a tornado for 15 months? What's your adrenaline like when the tornado sirens go off? What happens when you hear tornado sirens? Your heart skip a beat? Do you get ultra sensitive, on high alert? Does your mind start racing? Do you think clearly? Or do you start thinking, well, I'm sure it won't hit me, so I'll just go look out the window? And maybe your spouse is yelling, get down here. Get in the basement, right? Adrenaline pumping. What happens when that's going on for 15 months? Is that good for your body? Is that good for your brain that's connected to the rest of your body? Since this is a FEMA project, we get all these FEMA manuals, right? Because FEMA is used to traditional disasters, right? I've been part of the Iowa Disaster Behavioral Health Response Team. That's a mouthful, right? I've sat with folks in Hamburg, Iowa, 6 weeks after the flood started, when the water was still at roof level, right? And talking to folks before they go back to their homes. We're used to disasters following a trajectory, a typical phases, right? I was really excited this week because we crossed over into a new phase of this disaster. We've been stuck for a long time, right? Where do you think we've been? In my opinion, we've been in the impact phase of this disaster for the last year, right? We know that this past weekend, 6,000 Iowans to date, over 6,000 have died. We know that just recently, we have over half of Iowans vaccinated, right? And so that was a message to us, right? That we're starting to move on. And now, as we move toward reconstruction, it's time to think about grieving, right? We've been on autopilot. We've been surviving. And we turned the corner. I was so excited. We've turned the corner, right? We're starting toward reconstruction, right? We're starting to do some things and changes are coming at us. Frantically, albeit, but changes are coming at us, right? That's part of reconstruction. That's part of rebuilding. We've been under this abnormal, prolonged amount of stress. And we know that for a lot of folks, being under that amount of stress for the duration of time we've been under it will be maladaptive. It won't be healthy for us. Our stress response system can't manage that. We have a capacity, right? And so at some point, we probably reached the capacity. Like we have a surge capacity, right? We can do above and beyond for a while, but at a certain point, we just can't keep that up. We're exhausted. And then we just can't do any more. How many of you reached your emotional surge capacity? once or twice or 3 times over the course, right? It's normal, it's okay. Because our bodies, our minds weren't conditioned for this event, this disaster to go on and on and on. And so what happens when we're under stress? Do we make good decisions when we're under stress? Has anyone here done something really stupid when they're under stress? You know, I've heard stories, anyone's welcome to share if you want, but I've heard stories of people being at the grocery store and their boss calls them, says, hey, remember that report I said wasn't due till next week? Can you have that to me tomorrow? They leave the grocery store, go straight home and start working on the report. The next day they get in their car, what do they find? All of their groceries, right? When we're stressed, our cognitive ability goes down, our memory, our ability to recall things goes down. Do we work at peak performance under stress? No. There's optimal stress, right? I do my best work the night before a presentation, right? Because I need that little bit of adrenaline to get it done. But being under stress with that adrenaline running for 6 weeks, 12 months, it starts to change your brain chemistry. It starts to impact your body and your health. And so we need to start having that conversation about what this has done to all of us, right? And so I love this mental health continuum, because let's talk about our mental health and our physical wellness and our mental wellness just like we do physical health, right? If you're injured or ill, if you see someone with a broken leg or a bone protruding, right? What do you do for them? Call 911 and get the medical care, right? Do we talk about mental health and mental wellness differently than physical health? Do we put it on the same continuum and say, you know what? If you're injured or ill, let me help you find a doctor. Let me help you find a support. Sometimes we don't know what to say, how to talk about that, what to do next. And so it's really important as we think about our mental health, what are the warning signs, right? How do you know you're getting injured or ill or things aren't going well? What are those signs? Have you seen those signs in yourself? Anybody seen those signs? I'm looking to the professional side of the room. I'm hoping they might interact with me. Maybe they won't. I'm not sure. Irritability. Not sleeping at night. Forgetful. Weight gain. Who hasn't gained the COVID-19? Seriously, right? I was at a training just this afternoon on a video call, and a good friend of mine who's a pediatrician, Dr. Shriver at Blank Hospital in Des Moines, she said that the BMI on average is going through the roof for children right now. It's a significant issue. Significant. Not being able to get out of bed. Frozen. That fogginess, maybe feeling foggy. How many people at some point throughout the course of the last 12 months has gotten up and walked around the house and been like, what was I doing? Or how many people have done that at work? Or even worse, how many people are working at home? Trying to focus, make lunch, manage the children, juggle all of that. Is it easy to get stuck with all of this happening around us? Absolutely. This is my favorite slide ever. I am kind of a research geek, and I'll be the first one to admit it. I was so excited when I started working on this project with COVID Recovery Iowa, because I'm like, what's the data? How do I know how Iowans are doing, right? And so the National Center for Health Statistics has been tracking, and they've been doing this for years, but they started tracking some more stuff at the beginning of the pandemic. And so there was a little delay from what they were tracking from 2019, and then they started tracking again. I was so excited. So in April, when I first started, and the National Center for Health Statistics restarted their every 2-week polling, I'm like, this is great, I can track this. So every 2 weeks, I go into the portal, I pull this data out. And what you're looking at is the number of Iowans who are expressing anxiety and depression symptoms for that 2-week period. Now, what you need to know is the baseline before the pandemic was 11% of Iowans were feeling anxious and depressed, right? What happened over the course of the last year? Over 30% of Iowans, over a prolonged length of time, have been experiencing ongoing anxiety and depression. That surprising to anyone? It was as high as 46% at one point. It's starting to go down. My hypothesis is we'll see a little spike up, and then hopefully we'll see it continue to trend down, right? Is it a good news that that's going down? It is. There's also red flags that we'll talk about in a minute when we start to see that trend down. The unprecedented thing about this is that anxiety and stress and depression has stayed really high for a really long amount of time. And so that has implications for our mental health professionals and our behavioral health infrastructure and our ability to help people that we really need to think about as we move forward. So, Gene asked, is it because people aren't admitted anymore? Or maybe people are starting to settle in. It's the new, I don't use the word normal. It's struck from my vocabulary. I refuse. And so, yeah, I mean, I don't know. But it's something for us to take into consideration, right? I don't know all the whys behind this stuff. Actually, I heard a great speaker just yesterday. Guess what? We're all amateurs at understanding a pandemic. Every one of us is an amateur. None of us have done it before. Who here's lived through a pandemic? Anybody? Is anybody an expert in treating trauma after a pandemic? Anybody? We're all amateurs. We've never done it before. Everything that's happening, we're making up as we go, right? So are we going to make a lot of mistakes along the way? Are a lot of people going to make mistakes along the way? Absolutely. That's part of this process. The other part of the story is who's been most negatively impacted, right? Because we know that the pandemic has disproportionately impacted subpopulations, right? I just picked this one out to highlight. There's lots of research out there right now. What age groups were most disproportionately impacted by far? And I think some of the statistics the mayor shared about younger than 18 is going to fall in line with the 18 to 29 lines, right? Under 29, exorbitantly disproportionately impacted their mental health over the last 15 months. Why is that? More social. Their employment is more service industry related. Their lives maybe were more disrupted in education, schools. What do you think about 50 years and older, especially men? What does that say? What implications does that have? I do a lot of work in workplaces and businesses and with CEOs. And there was beginning to be a growing disconnect between that young workforce and the expectations of mental health supports at work. That has exploded over the last 14 months, right? 18 to 29-year-olds, when they go to work, expect that you care about their emotional well-being and that it's part of your workplace culture, right? And so we have conversations about employment and work, and where are people? People are going to jobs where they feel supported, especially younger folks. And there's a lot of individuals who are supervisors or managers or executive directors that don't understand why it's important to have a healthy, emotionally healthy workplace. I have to interject a little bit of rural stuff in it, right? I couldn't be a farmer and not talk to you about that this is impacting all aspects, right? Part of the project I oversee is partnered with Iowa State University Extension and Outreach. They do great work with us. It's just fantastic that we're able to leverage all of their resources and insights and knowledge of their folks and Dr. David Brown over there. But we underestimate the impact across the state. You know, we all have connections to rural Iowa. All of Iowa is very rural, right? And this is very impactful there. And I just love this poll from December. And the takeaway is 87% of farmers and farm workers say we have to reduce stigma because it's a barrier to us being healthy. And so when I heard the mayor talking about some of the initiatives and why we're here to talk about May being Mental Health Awareness Month, we can't do that without talking about stigma, right? Because that's a huge barrier in being able to have these conversations. And at the end of the day, if we're not having those conversations, if we're not talking about it's normal not to be okay right now, then we're missing an opportunity. And stigma is a barrier in us being able to let our hair down and say it's okay not to be okay. There's no reason we should be okay right now. I've been sitting at this intersection. This wasn't taken in Ames, so it's okay. How many of you have been at this intersection? I keep pulling up to it. I keep going a different route, and I keep ending up back here. This past weekend, my oldest son's a senior in high school, so he graduates this weekend. Last weekend, we had his graduation reception. On Friday, my wife had to go, we live north of here, had to go to the city hall and sign the paper because we rented a city venue that we wouldn't get our deposit back unless everyone wore masks and we had to follow the reduced capacity limits of the facility, right? My wife's a rule follower. That same day, the CDC said what? If you're vaccinated, you don't have to wear masks. So there was a lot of confusion, right? So it was comical. The next day, we're going to graduation receptions. You know, people are coming to ours. And every time you have this awkward conversation. Are you vaccinated? I am. Are you vaccinated? Should I wear my mask? Should I not wear my mask? Can I stand out here? And it got hilarious, right? Because what else could you do but laugh? Because no one knew how to act. Everyone was here. What do I do? Every choice seems wrong. And that's anxiety provoking, right? That's emotionally zapping. Am I alone? Am I the only one at this intersection? So how do you manage, right? What do you do? It's kind of summer, so we're going with a water analogy. I stole this from a colleague of mine, right? It's just waves. How do you ride the waves? Which one are you? So I spiced it up a little bit. That's actually me going across Lake Okoboji. I made a GIF. I know my son was very proud of me. When I'm going across Westlake and it's windy, anybody ever go to Okoboji? When I'm scooting across the lake and it's windy, I love to go fast, right? What happens when I go really fast and it's windy and there's like 2 or 3 foot swells? Right? I get to the other side fast, but I look around and there's nobody left in my boat. They all bound. I went back and picked them up. Everybody's wearing life jackets. It's okay, right? Sometimes we're just so focused, we're just going. And we're just going to burst through those waves, whatever it is, and we're going to get to where we're going, right? That's how some of us manage. I've been known to do that. Head down, go. Some people manage kind of like a raft. Do you have any control over a raft? You're just on it for the ride. You put the raft in the Des Moines River, where are you going to end up? In the Gulf, right? Maybe stop in New Orleans. You're just going to go where it takes you. What if you're a sailboat? You raise your sail, you catch the wind, and you can go for as far as it'll take you, right? You're never going to run out of gas. And when there's a storm, you can put those sails down and you can drop your anchor. And you can batten down the hatches and you can wait it out. Is there a time and a place to be each one of these boats? What are you? Are you the raft, just going along for the ride? Are you the sailboat, heads down? Full speed ahead? Or are you that sailboat? And whatever boat you are today, let's think about how do we anchor ourselves? And how do we really manage? And so I like to make it simple, right? So we're going to stick with ABCs. Can everybody remember ABC? Activity, boundaries, and connection. Thank goodness it's summer, right? We can get outside, we can breathe fresh air, we can get our bodies moving, be physically healthy, get our brains moving. Setting boundaries. Why are boundaries important? Is it important to set clear boundaries? To take care of yourself? Create healthy, positive connections with others. Be social. Get together with people. Can't talk about boundaries without quoting Brené Brown, right? Daring to set boundaries is about having the courage to love ourselves even when we risk disappointing others. 2 most important boundaries you can set are what? Saying no and going to sleep on time. What's the number 1 risk factor right now we see in essential workers? We see in a lot of the data for healthcare workers. What are they reporting? Exhaustion, which leads to insomnia. Not sleeping at night. One of the things I did early on in the pandemic is I said, I'm going to get sleep at night. I'm not going to stay up late. I love to get up. I'm a morning person. I love to get up and have a cup of coffee at the crack of dawn, make myself a fried egg, a little provolone or Havarti on top. It's my morning routine, right? But I got to go to bed early because I need to reset myself every day. I made that commitment, and it's been wonderful. How hard is it to say no? Is that easy for us generally? How hard is it to say no to your boss? And set that boundary. If this weekend is the first weekend you can go and see your grandma or your mom, and your boss walks in on Friday afternoon and says, hey, can you give me this report Monday morning? Is it okay to say, no, I've got plans, and I need this time for me? We really need to be able to do that if we're going to put ourselves first. So challenge yourselves on how do you set boundaries? How do you implement the ABCs of self-care? You know, and as we think about wellness and the 8 dimensions of wellness and all that goes into wellness, you need to think about all these areas of your life. And how are you putting time and energy into all of them? Because if you're not taking care of yourself, how can you be there for other people? It's okay to put you as number one, because if you're healthy, you're going to be more valuable to all those people around you, to the people who rely on you at work, and the people that rely on you at home, and the people who rely on you in your community. And if we're doing those things, and we're building up all those protective factors around us, then we're not going to experience chronic emotional exhaustion, that compassion fatigue, that burnout that comes along. Right? There's a lot of stuff out of our control right now. Right? We can't control it. We have to learn to let go. We have to stay positive. And we have to learn what our triggers are. Today was not a good day to be on social media. I had to finally just put down my phone because that wasn't good for me. That was a trigger. It's okay. I labeled resilience because resilience, there's several definitions of resilience. So you got to go to dictionary.com, you got to go to all these different websites, right? One definition of resilience is returning to the same form it was prior to an event. That's not the resilience I'm talking about, right? The last 15 months wasn't where we just hit pause and now we're going to push play and start over, because we can't unexperience the last 15 months, right? So resilience is how we move forward after a change, how we move on. And so we've kind of talked about building connections, fostering wellness, finding purpose, looking at all the things that are better. We've learned a lot. And there's been a lot of good things too. And we've got to learn to ask for help and make it okay to ask for help. And I hope our panel talks a little bit as we go today about that intersection between accessibility, availability, and acceptability. Because just because something's accessible and available doesn't mean it's acceptable at your workplace, in your community, or within your culture or your family. We have to find the intersection of all of those things. And so we have to create accessibility and availability and make it acceptable. We have to hit stigma head on. We have to be honest with ourselves about what our needs are. We have to ensure that it's available in our community. And we have to create access so everyone has a level playing field and can get there who needs it. I'm a big proponent of health literacy because I believe we need to be teaching it to talk about it. And the only way we can learn about how to talk about these things and do it in a way that's not stigmatizing, that's culturally responsive, that meets people's needs, is to teach it. And I'm just ecstatic. Oh, I'll get there in a minute. There's another slide. And why do we need to do that? It's Mental Health America Mind in the Workplace study that just came out here in 2021. 40% disagree that I know what resources I need at my workplace to take care of myself emotionally. I was at a large company in Des Moines earlier this week and facilitated a conversation with all their employees that were in the office for the first time in 12 months. And the HR person told me, this is the first time we've ever talked about mental health at work. Go easy on us. I said, it's going to be okay. The staff just soaked it up. They're like, we've been wanting to talk about this for years, but we never thought we could. Let's have that conversation, right? Because it's not happening. The statement, my employer provides a safe and welcoming environment for employees with mental illnesses. 56% disagree. I think that tells us we have a lot of work to do in getting open and honest with ourselves. I'm ecstatic of hearing about mental health first aid being available and accessible so that members of the community can have access to go and learn, right? I'm a big advocate of mental health first aid. I teach mental health first aid as part of the EAP program at Iowa State. I've been doing online virtual mental health first aid courses for the last year with faculty and staff. It's a great conversation. There's lots of opportunities. We're going to have a lot of opportunities for you, so I can't wait to work with Julie and see how that rolls out. But that's your opportunity to learn more. It's your opportunity to really kind of dig into this and feel confident that when someone's experiencing a mental health crisis in your community, on the street, at your workplace, at your next family reunion, that you know what to say, that you know how to guide them, that you know what resources are available in your community. Because sometimes it's hard to figure out, right? And you're going to have this expert panel here in a minute. They're going to tell you, this is how you access services. This is what exists. Maybe you've never heard of this, but this is what we can do. It's there. Sometimes it's just hard to find. And we got to make it easier for all of us to know where to go, when to go, how to get there, and get to the right place at the right time. Because so oftentimes we get frustrated going to the wrong place and then getting sent over to a different place. We've got to make it easier. And they can do that for us. And it's awesome. So as I conclude, the stress we're all experiencing is unlike anything we've ever experienced before. Was anyone here in 1918 for the Spanish flu? No. This is new for all of us. We're all amateur pandemic experiencers. Reacting to stress requires a new approach. Change is hard. We can all learn it together. What was happening before this pandemic wasn't necessarily working. So let's figure out something better moving forward. We're moving into the grief phase. Before we can move into growth and rebuilding, we've got to let go. And we've got to grieve that we've lost. Right? It's part of the steps. It's part of the process. And we're all experiencing at different intensities and different levels. And we all grieve differently. So it's going to be different for each and every one of you. But it's a step at some point we're all going to have to take. We can learn resilience. And probably most importantly than all is our words matter. What we say matters. And we got to be able to start talking about it. The elephant in the room. We've got to start having that conversation. You know, at COVID Recovery Iowa, we've been that extra layer of support across the state since last May, end of April, May. When there's a disaster, when there's a presidential disaster declaration, funds are released. This is the first time every state and territory in the United States of America has been under a presidential disaster declaration. That's never happened before. This is the first time that we've conducted a FEMA disaster relief project that was 100% virtual. We do a ton of stuff online. We provide support, and then we refer people on to local providers and professionals. Our systems will be inundated with individuals struggling with their emotional well-being? When do things generally get worse? When things get better. As we slow down and reflect on everything that's happened over the last 15 months, as we start to return back, right? As we start to re-enter some of the things like they were in the past, then all of that emotion is going to come flooding over us. Because we won't be on autopilot anymore. We've been heads down. It's anxiety-provoking to think about, for many, taking our masks off and going to the restaurant, right? That's probably going to bring out emotions in some folks, right? And so that's part of our challenge moving forward. And so we're doing all kinds of things to talk about that and connect. And so if you need to talk, get on Facebook. We're part of the Kindness Rocks. Anybody aware of Kindness Rocks? Anybody painting rocks, taking pictures of them, uploading them to Facebook? Post them to our site, right? Get out there, look for them along the paths out at Ada Hayden. There's so many great things we can do to connect and be joyful right now. Connect with us on Facebook, Twitter, Instagram, LinkedIn. We want to be that connection point, and we want to support all of the local providers and professionals across the state in doing this, having the conversation, going to your workplace and having the conversation, helping to facilitate getting more mental health first aid trainings in communities all across the state. We're there to provide that extra layer of emotional support that's needed when we're overwhelmed and when our systems are overwhelmed. And so I look forward to our panel coming up. Julie, I think I'm turning it over to you. And having our panel come up and talk about what they're doing. And I'll be happy to take some questions at the end, or I don't know what the process is.
Thank you so much, Jason. And thank you also for everything that you do for our community. We really appreciate all of your efforts and hard work. We'll be moving into a time of our panel discussion. And once everybody gets up here, we will have each panelist introduce themselves, who they are with, and a little bit about their organization. When our last panelist introduces themselves, then we will move into our Q&A portion of the evening. Who's got the mic? Go ahead.
Hi, I'm Dr. Kayla Davidson. I'm a licensed clinical psychologist at Central Iowa Psychological Services. We are located in Ames, Ankeny, and West Des Moines. We provide a variety of services, including individual mental health counseling, psychological assessments, substance abuse evaluations, medication management, and currently in our Ames and West Des Moines location, TMS.
Hello, everyone. I'm Angela Tharp. I'm the Executive Director of NAMI Central Iowa. NAMI Central Iowa, we have a catchment area of 9 counties. Story County is where our office is housed, just across the street. What you can expect from NAMI is that when you call, you will be in contact with somebody who is either living with mental illness or has a loved one with mental illness, or both. So we're not the trained psychologists. We are just everyday people who have lived experience. And by that, we can relate to families and individuals living with mental illness in a way that somebody who's never experienced it cannot. And so our services include, they're free, and they include support groups, educational classes for family members, educational classes for the individual with mental health conditions, and then we also offer public presentations where we have, it's called In Our Own Voice or Ending the Silence. In Our Own Voice tends to be like a workplace environment, or something like that. And then the Ending the Silence is a presentation that is at junior high and high schools. And just to show you the value of that program, last year our data showed 604 out of 604 students that answered our survey said, because I listened to this program, I now know mental illness warning signs, I now know suicide warning signs, and I know who to go to in my school if I see them in myself or others. Oh, and I forgot, we also have a drop-in center that is open just for anybody to come on by and to hang out where we work on recovery skills.
Hello, my name is Joseph Fox, and I'm a licensed mental health therapist at Youth and Shelter Services in Ames. And we offer individual therapy, family therapy, play therapy, substance abuse counseling, mental health assessments. YSS also offers a variety of programs for youth. Something I want to emphasize, and I've always wanted to emphasize at YSS, is that we serve all variety of age groups. So even though we focus on youth and adolescents, we take everybody, and we serve adults. And as a therapist, I work primarily with adolescents and young adults, as well as people that are well into their 50s and 60s. So I want to get the word out there that we serve everybody. And we really focus on the family as a system. And we believe in, the whole person. We have a wonderful array of different clinicians that have different modalities. So check us out. And one last thing I'll say is that YSS has been here for quite a while, and we're here to stay, and our doors are open for you. Do not hesitate to reach out to us if you need us, and we're not going anywhere.
Good evening. My name is Carla Webb, and I am the Operations Officer with Central Iowa Community Services Mental Health Disability Services Region, otherwise known as CICS. Our office is located here in Ames at the Story County Human Services Center building on South Kellogg. CICS actually consists of 11 counties that are located within Central Iowa. In July 1 of this year, we'll be adding 4 counties to the north of us. We have staff in our office that provide information and referral services, so they are able to meet with individuals in person or talk with them over the phone. Right now, we're doing a lot of Zoom meetings, we try to be very accessible, so any way that works for the person, we want to help them identify what their mental health challenges are right now, or also it could be individuals living with intellectual disabilities, developmental disabilities, or brain injuries. We can help connect them to the resources and the various services that you see here tonight, as well as many others that we have available in our community. We also fund services for folks, so if they are uninsured or underinsured, they may be eligible for funding through our office as well. Another thing that we do is develop mental health and disability services. So we do partner with a number of counties around us and other mental health regions to develop access to services. Something I want to point out is crisis services that are available currently to all residents within the CICS region. Bree here will be talking about mobile crisis response and community-based crisis stabilization services. Those are available to anyone at no cost. So we certainly encourage you to reach out. Please call the crisis line, your Life Iowa line. Again, all of those services are confidential and at no cost. Out front, we do have crisis line cards. I encourage you to take those, share those with your friends and family. We also have the yard signs out there that have the crisis line and the mobile crisis response information on them. If you are willing to put a sign in your yard, that would be great to help promote that information to your neighbors and those around you. So currently we have 4 staff in our office that can meet with individuals to connect them to services, and 2 of those staff are dedicated staff at the Story County Jail. So they meet with individuals who are currently incarcerated and help to connect them to mental health services that are available within the jail, and then also help them arrange for services once they are released from jail. On our website, which is cicsmhds.org, you can find a directory of adult services and children's behavioral health services. So I would encourage you to look there as well. If you're unsure of what's available to you, that's an option where you can find that information, or you can certainly reach out to our office. We're definitely here to help, and we love interacting and visiting with people. Thank you.
Hello, my name is Cassie Cheney. I work for Optima Life Services here in Story County. We offer a wide variety of services all across central Iowa. Some of those here in Story County include services in the community and in residential settings. We offer jail diversion services, occupational therapy, home health services, behavioral health services. I have also left information at the front as well.
Hi, so I am Bree Dagla. I am the Community-Based Crisis Services Supervisor at Irely Ball. So I directly oversee our mobile crisis response team as well as crisis stabilization community-based services. So like Carla was mentioning, both of those services are available to anyone of any age. We do currently serve Story County alongside 12 other counties. So anybody is available to access that service. It is free of charge. Thank you to the region. So what you can kind of expect with that service is we always have 2 individuals in each team for our mobile crisis response that are available 365 days, 24/7 to respond to anyone that's experiencing a mental health crisis in the community. So the great thing about the program is that we do not define a crisis. So you don't necessarily need a mental health diagnosis to call into the line. It could be as simple as someone that's just having a rough day, all the way up to someone that's experiencing a traumatic event. So what you can kind of expect when you call into the Your Life Iowa Crisis Line is all of those individuals that do answer the phone are trained counselors. We call it a dispatch center that is actually called Foundation 2, based in Cedar Rapids. So they field all of those calls for our mobile crisis response team. And if they think an in-person response would be beneficial, then they are able to dispatch our team of individuals to meet that person within the community. So that could be in their home, at Perkins, at the public library, wherever they might be needing that service. We're able to sit down with them, use some de-escalation tools, and really focus on safety for now and providing that listening ear and support at that time. So as far as our crisis stabilization community-based service, that's kind of in addition to mobile crisis. So those individuals that call into the crisis line and our mobile crisis team responds, we have the ability to refer on to that stabilization program, which is 5 days, and it is also community-based as well. So they provide wraparound psychiatric services throughout that time, including daily contact with a licensed mental health professional and in-person contact with a case manager as well. And also the region funds that through ITP, so we do have access to a medication provider at that time. So there's a lot wrapped around both of those services, but they are available 365 days, like I said, 24/7 to the community.
Hi, everyone. Is this on? Maybe I'll take this one. Hi, everyone. I'm Kinsey Phillips. I work as a mental health advocate at ISU Police. I'm on campus, and I support student, staff, and faculty who are working through mental health-related challenges. A lot of what I'm doing is going out with officers on our welfare checks and making sure that, like I said, our student, staff, and faculty are doing okay if they're in crisis. I also work as the liaison between ISU PD and our student resources or departments. So places like Teelan Student Health, Student Assistance, and Student Counseling are some of those. I often connect students to those places so that they can be supported when they're here on campus, and just making sure that they're getting the appropriate mental health help that they need. I also have a certified therapy dog that works with me. She unfortunately couldn't be here tonight, but she wishes she was, and she's a really fun part of the job.
Is this, oh, it's working. I'm Tricia Crane with the ARC of Story County. The ARC is best known for the advocacy work on behalf of people with intellectual and developmental disabilities living here in Story County. We also have what is called our Active Lifestyles program, that is probably what we're best known for, which is our social and recreational program for individuals with intellectual and developmental disabilities. It centers around mostly the Special Olympics activities and calendars that we oversee and coordinate. So when we are not in a pandemic, we typically have something going on almost every single night of the week, whether it's social or recreational for people with intellectual and developmental disabilities. Area providers such as Optime and Mainstream Living and Friendship Arc Homes and parents and guardians know that they don't necessarily always have to have something on their calendar. All they have to do is look at the ARC and they know that there's always something going on. We also have what's called our Project Search program, which is a 9-month-long employment training program that is hosted by Iowa State University. And then we have our respite care, respite funding, and our care coordination that takes place on behalf of people living with disabilities here in Story County.
Good evening, I'm Brian Carrico, and I'm the Therapeutic Learning Coordinator for the Ames Community Schools. And I want to say thank you to all of these people because we benefit greatly from their services and the things that happen at our school. This is a new position for Ames Community School, is created this year to help with the mental health crisis that we are seeing in our students. So far this year, we have implemented a mental health screening for students. We have implemented training for both our counselors and our student and family advocates or our social workers. And we are working on a 5-year plan for the mental health for the Ames Community Schools. We've also partnered with YSS at our middle school for school-based therapy, and we've also partnered with SIPS for school-based therapy at our elementary level. So again, we're just very, very thankful for all what you guys do because our kids benefit daily from it.
I realized I should probably introduce myself as well. I'm Julie Saxton. I am the mental health advocate with the Ames Police Department. I have been in this position over 6 years, and I work with individuals in our community that are struggling with a variety of mental health related issues as well as substance abuse issues. I am the liaison between law enforcement, the providers, and those that are struggling. I work with probably over 90 different providers in our community. Most of these folks that you see here, I work with on a regular basis, and I can tell you that each and every one of these individuals is absolutely amazing at what they do. They are compassionate, they're caring, and they're going to do whatever they can to help you and your loved ones. So please don't hesitate to call me as well at the department, and I am more than happy to lend an ear and get folks connected with the appropriate resources here in our community.
Good evening, everyone. My name is Deb Shildroth, and I'm Assistant City Manager for the City of Ames. Thank you all for being here this evening. Thank you for the folks who are viewing this online. We are moving into our Q&A part of the evening, and so if you have a question here in the auditorium, if you will move to one of the microphones standing in front here to do that, that would be great. That way everybody can hear your question. And for those of you watching us through Facebook or YouTube, please type your question in on the chat, and we'll make sure and get that question asked as well. So if there's someone who would like to kick off with a question, you're welcome to step up. Maybe it's working. There we go. I just need to wake up. one of the things that the mayor said earlier was about the Iowa Youth Survey and the increase or the alarming statistics for our kiddos who have considered suicide over a 12-month period. I just want to know, Brian, from you and any others, what kinds of things are you seeing right now with your students because of the pandemic?
Thank you for the question. One of the things that was eye-opening for me is when we were doing our screenings, we screened 4th, 7th, and 10th grade students. And it was the revised childhood anxiety and depression scale. And it's a 43 question that the kids answered, and it scored it automatically on a norm scale. If the students scored within the norm, they saw a debriefer, and we talked about, do you feel comfortable? Is there something that you want to talk about? And if there was a time that you felt that you needed help, was there somebody at the school that you knew that you could go to? If the student scored above that norm, then they were seen by a clinician, a licensed therapist from SIPS, and then our AEA personnel of school psychologists and social workers. And one of the things that was eye-opening to me was at each level, 4th, 7th, and 10th, students who saw the clinician mentioned the fear of COVID. There was a large portion of our kids that mentioned, the fear of losing a grandparent, or because one of the questions in there is, do you think about death? And the number of kids that marked that and said, yeah, because of COVID, we think about, the death of our family, the death of our grandparents. What's that look like? How do we help? So that was one of the things that for COVID that we noticed. The other thing I think is that the kids that are coming into the schools now they've been isolated. And I guess I have seen the last several weeks I've been working at the high school, and I have seen some social skills, that the students coming back together and being able to be with each other or having that connection, and seeing an uptick in that, that enthusiasm. So that's a good part. But I think that the thing that worries us the most is that before the pandemic, 1 out of 5 students nationally or within our own school district have a mental health concern. And we don't know what that impact's gonna be as we pull out of the pandemic. Does that answer your question? Okay.
I was just going to add, at NAMI Central Iowa, I would say mostly prior to COVID, we had adults were the ones seeking and reaching out to us. And it surprised us, but did not surprise us, that all of a sudden we now had the children walking through our door saying, since I've been home, I think my mom or my dad has mental illness, and I don't know what to do, and I don't feel safe, or how do I get them help when they're not seeing this themselves? So that was new this year for us. And then we've definitely had an increase also in asking about youth support groups. NAMI Central Iowa's, ours are for adults 18 and older. So COVID Recovery Iowa has been a blessing because we've been able to refer to that.
The other thing we're seeing a lot of is kids struggling with the virtual or hybrid learning. I've seen a lot of kids struggling with time management and organizational tasks related to the combination of learning methods. And that's been probably one of the big concerns, in addition to what these other people have said, that I think is one of the side effects of COVID.
I guess I would add a little bit to that, though. We also have seen some kids that struggled with anxiety and some of the other mental illnesses in a comprehensive school that have kind of thrived off of the online learning. It's been an opportunity for them to learn in a safe environment of their home without having to worry about the anxiety and the other things. So while, yes, there are a lot of students, I would say probably more students that have been impacted negatively, there have been some benefits of the online learning, and the educators have really, I think, been extremely professional in, I don't know of any other industry that could change their whole functioning in 4 months. And that's what happened when, we broke in March and we came back. Education was turned upside down, and our educators did, an amazing job of making that switch and doing things. I also know the kids been very appreciative. I've heard that more than this year, that kids have said, thank you to teachers. So that part is a positive.
Yeah, I want to shed some light on what Mr. Carrico said at the top with isolation. We live in this world where, our lives are kind of dominated by social media and being connected through the internet somehow, some way. We have all these different platforms, and it struck me how, even though we can basically connect anytime, anywhere, that there is a huge disconnect at the same time. And learning how to listen and have the conversations that we need to have about all of these things. And kind of what Mr. Haglund was saying in his keynote speech, we need to create connection. We need to help these children, adults, families, etc., learn how to have these conversations out in the open. And it's cliche, but it's true. It's okay to not feel okay, especially right now and in the last year and a half or so. And I think what the pandemic has done is it's really opened up the conversation about the things we're talking about tonight. Mental health has always mattered, but it matters even more right now. And I think having these kinds of talks and get-togethers, this is helping open up those doors for that. So I just want to say that no matter who you are or where you find yourself, that we up here and many others throughout the state are here to help you the best that we can.
Good evening. I have to say that when I look up here, what I see is an abundance of wonderful resources. Yet I know that actually the reality is that it's terribly under-resourced in the state. So, looks can be deceiving, right? So what I'd like to ask is, what is your insight about how to address the resource deficit for mental health? Some of the old sources are not really providing anymore. So what's the hope? Where do you think the future might be in developing new sources? Will probably take some time, but what do you think they might be?
So folks may know recently the governor signed Senate File 619, I believe it is. And that is shifting mental health funding from county property tax to being fully funded by the state. And that transition will start to take place this coming July. I think with that transition in time, there's going to be a lot more money put into the mental health system. So with that, hopefully we will see the ability to continue to develop mental health services. The state is requiring certain, we call them core services, to be available by July 1. So mental health and disability services regions are working very hard to get those services developed. Within CICS, we have all but, I believe, one of those services that will be up and running by July 1st. The one service that is yet to get developed is intensive residential services. And we're just facing challenges with providers being able to provide that level of service. There are staff shortages. There are challenges that come with the requirements of that service that we still need to work through in that. I don't think there is any region within the state yet that has that service developed. So that is something we're definitely working on. The community crisis stabilization community-based services that we have available, that service started February or so of this year?
End of January.
End of January. And CICS was the first region to have that service available. And I think good things are coming from that. We're seeing people utilize that. And so hopefully that can maybe be a model for other regions throughout the state. And we are actually partnering with another region to have that service available come July 1 as well. So certainly regions are working hard to partner together to develop the services. It will be a big shift in the change from county property taxes to state funding, and we have to figure out what all of that means. How is all of that going to work? But definitely, it sounds like there will be more money coming into the system. Hopefully, the state is able to continue to provide those funds, and I guess we'll see where things go. But a lot of good work is happening, certainly. So, but there's still a lot of work yet to be done.
In addition to the bill you just mentioned, I believe they also included a line in there allowing for what's called telehealth parity, basically expanding telehealth services across the state. One of the things that's been really helpful during the time of COVID is utilizing telehealth or basically Zoom type calls for therapy. We've been able to see people in rural parts of the state. So as Mr. Haglund was talking about farmers accessing resources, this is a really great opportunity for them. It's a really great opportunity to get some of the people in more rural parts of the state accessing services in the more urban parts of the state where there are more clinicians. So that was another benefit that we've seen. And then I can speak specifically for SIPS. One of the things that we're doing is we've been expanding our services. So instead of just therapy and telehealth therapy, we also added some medication providers who provide medication management. We added TMS, transcranial magnetic stimulation, to help people with pretty severe depression, and navigating ways to stay safe with all of those throughout COVID. So that's kind of what we're doing on the private practice side of things.
I would say educationally, I think it's going to sound kind of weird, but schools are now being recognized for the importance of mental health. When you talked about, or when we hear about the biggest concern from parents about their kids not being in school, it's their mental health. And so for schools and for the state to begin to think of the school place as somewhere that students can be supported, I think that opens up a lot of avenues for schools. I know right now we're applying for 2 grants. One grant, our plan, if we get the money, is to create a therapeutic learning community for our elementary school students. Those students are having mental health concerns, and what we plan on doing is, staffing it with people who are trauma-based, trauma-informed, and we're really looking at the CBT, cognitive behavioral therapy, as the mode of how we're going to operate that classroom. The other is a governor's emergency relief grant, where it's going to offer $325,000 to schools the size of Ames. And, in there we're looking at training all of our staff in youth mental health first aid. And then we want to become self-sufficient, so we're going to train teachers how to be those trainers. And we're also looking at increasing some of our work with our student and family advocates or our social workers. So, you know, in the bright side or the silver lining, like Mr. Haglund said we have to find, you know, I think education is coming out of this with a better understanding, or the community has a better understanding of what our potential is to really help our students. And so that's been a plus for the schools. I know this year we had added school-based mental health therapy at the elementary level, and we hadn't had that in many, many years. But people understood that, you know, our kids were struggling and we needed that. And so I guess that's a positive for us.
I just wanted to quick add that I am working with Senator Quirmbach on a mental health bill that would hopefully provide funding for local law enforcement agencies for them to be able to hire a mental health advocate that would mirror my position for quite a few agencies throughout the state of Iowa.
Other questions? And again, for you, those of you who are listening and joining us online, please type your question in the chat box and we'll make sure and get that asked of our panelists this evening.
Yeah, this has been great and learned a lot. I don't remember all of your acronyms. And frankly, I'm not sure who to call for what. And maybe that's what the city is going to help us do, and this is maybe a first step toward it. But like, I took some pretty good notes tonight, but I'd love to have a transcript of what you all said that would help me actually know how to use it, because I got a little bit anxious tonight, knowing it's there, like, oh no, who is that? No, and you went first, so like, you got lost in all this.
You know, what I would say is probably call any one of those numbers, and I think any of us would try and help get you pointed in the right direction. I don't know if that helps or not, but certainly everybody here, I think, would do their part to try and get you connected.
You also might mention Iowa 211.
Oh, yes, and there is 211. That's a great resource that you can call, and I believe it also has a web-based component to it, so you could get online, plug in your zip code and what you're looking for, and it'll come up with a whole list of resources that are available.
There's also going to be a 988 number that's going to come out, and the 988 number is going to be a suicide hotline. So you don't have to remember the 1-8-235-TALK, or what is it? I don't even know it. That's terrible. So that's going to be a positive. There's also the first transgender youth hotline that has just come out too, and that's another group that we have seen. You know, some of the surveys that have come out that said that, you know, the transgender and LGBTQ students have really felt isolated, and especially if they're not accepted at home. With this increased amount of time at home, there's been a lot of increase in thoughts of suicide and mental health for that group of students too.
I'm going to give you my phone number, my direct line. It's 515-239-5463. And I have every one of these individuals' email and phone number and a description of exactly what they can do and how they can help you out.
Also, real quick, I think you can just cold call anybody. I know a lot of people often ask if they need a referral for therapeutic services, and you do not. And if you do, we will let you know. But otherwise, you can just call and schedule an appointment or call any of these other people, and I think they would be able to help you directly.
I'm also going to point you to the program on the back. We have a list of resources and phone numbers, and some of them mirror the individuals that we have on our panel tonight, but there are some extra ones, so please feel free to use this as well. And Tonight's program will be archived on the city's website, and so you'll be able to go back and listen to it and catch the names and agencies that were represented tonight. So we'll try pushing this information out as much as possible. Jim.
Brain health, mental illness comes in many different forms. Of the folks that you see in your particular practice, what difficulty, disease, brain health problem, whatever you want to call it, is the least well observed and would help the audience to know characteristics of it to help them identify, to get them to you? Probably the people who are here tonight may or may not need your services, okay? But they may know somebody who does, if we know how to help to identify those needs. I'm going to sit back down so I can take notes, okay?
I think that one of the hard parts with accessing services is the person needs to be willing to go to services. So there are a lot of people, I think almost, in my opinion, everyone could benefit from therapy or from some sort of mental health service. And one of the things I love that Mr. Haglund reiterated multiple times is trying to reduce the stigma around mental health. However, people who are really struggling with mental health don't always want to receive help. And I think that's one of the biggest barriers. And that's why we have some of these emergency resources, because it's not until they're in crisis that they actually call out for help or someone calls for them.
And definitely on that note, to know the warning signs with mental health conditions. Definitely if you're noticing certain behaviors, which include, everybody help me out here, we all know them. Talking about being very hopeless. Their eating habits have changed. They're either eating too much or not enough. They're either sleeping too much or not at all. The isolation is huge. Are they isolating from things that they normally have done in the past? Are they doing pretty risky behaviors? Things that really they've never done before, and so it seems a little odd. How are they self-medicating? Many times you'll find the individual is drinking more. As you were sharing that about the younger, your statistics on the younger population, that's what we've had a lot of, saying, I don't know what to do, so it's become a bottle of wine every night. So definitely, is it alcohol? Is it drugs? Is it escaping into gaming? Is it, what else was I thinking? Retail therapy. Or, my husband might say, yes, that is, by the Amazon boxes showing up at our house. But, knowing these warning signs, and if that lasts 2 weeks or longer, that's kind of a good thing to go by. And like you were saying, many times the individual doesn't want the help, but we're recognizing the symptoms. So we strongly recommend when individuals call us and say, my son or my daughter or my mom won't get help, if we can say, do you know who their doctor is? And we say, write that doctor a letter. Send self-identify or give that information to somebody you know who could make a difference. Because yes, the doctor won't be able to talk to you or the therapist won't be able to talk to you, but you've given them an outsider's view of what's going on. Because individuals with mental illness, we have to overcome our own self-stigma. And that's because of society, what society has said about medication, what society has said if we end up going to the hospital on the behavioral unit. There's so much stigma that exists. So by talking about it more, by having all these individuals I feel like we're educating ourselves so we can better help those that are struggling.
Yeah, and just to add on that too, so for the Your Life Iowa crisis line, actually family members, law enforcement, mental health professionals, anybody can place a call to that line on behalf of a friend, a loved one, a client, any individual in the community. So if you are with a friend or family and you notice that some of those changes in behavior like Angela mentioned, and you are concerned, sometimes it's just great to start that conversation like Jason said, just ask, how are you doing? Are you okay if I call someone for you? I'll sit here and coordinate that. And then our counselors are able to respond to that person. Sometimes it's a little bit less intimidating when it's in their home. We come in unmarked vehicles. It's really just two individuals that are just wanting to provide that support. So sometimes that's just a really great gateway in. And then actually after each crisis call, we do have case managers that follow up the next day. And then we can kind of get them connected to any of these individuals in the community for some of those long-term services. So sometimes that first step, they really are just needing that assistance and getting the foot in the door to make those connections.
Yeah, I'm going to refer to a quote from way back in graduate school at Drake University by one of my favorite professors of all time. He said, "The art of being a therapist is listening for what's not being said." And so oftentimes as therapists, we are looking for and listening for things that might not actually be said out loud. We're listening for patterns, so to speak. We're paying attention to the patterns. And as these wonderful ladies over here mentioned, it's learning how to identify symptoms. And oftentimes, the biggest barrier for an individual that needs mental health therapy or services oftentimes is themselves. They have to be willing to come in the door. But I think what I hear everybody up here saying so far is that our doors are open, and we're here, and we will do what we can do to provide the best services for you. So, to kind of answer your question a little more directly, depression is something, for example, that has different extremes, different spectrums with it. So there's folks that struggle with minor acute depression, and then you have the more chronic, can't get out of bed, can't function, can't really do anything. And oftentimes a depressed person on more of the minor level, you can't actually tell that they're depressed because they put on that mask. They might be smiling and they might present as they're okay, but they might not really be okay underneath all that. And that's when I think as a friend, as a family member, as a parent, as a teacher, a school counselor, etc. That's where our jobs, become vital and crucial. And I think it's a community-based effort. It takes all of us, and it starts at home. It starts with our agencies. It starts with having the conversations about all this stuff, and learning how to listen better, because we have a world full of people that desperately need to be heard and listened to. So yeah.
I was going to say, if you want a little pocket card to go along with the CICS crisis cards, we have out on our table there these little pocket cards for the suicide warning signs, because they sometimes are a little bit different, harder to identify. But then it also, one side of it has questions on how do you talk about it. And I think one of the biggest things to say is not what's wrong with you. Instead say, what's happened? What's happened? I'm just noticing something's a little off. So not what's wrong with you, what's happened.
And that's really the importance of mental health first aid, right? Of that's how the community can respond, because not everyone needs professional help, but they need support and they need people to notice. And the hardest part is having a loved one or someone, a coworker, notice that something is different. And so the key is noticing and helping someone to identify. and then helping to encourage appropriate treatment. And that's where our professionals come in. So if we're help guiding people to the appropriate resource at the appropriate time, then we don't have a system that's overwhelmed. Because right now we have a system that has a lot of people going to the wrong level of care, right? And when I say level of care, it means sometimes, in a medical sense, we have people who should be who are in the emergency room who should be seeing a nurse practitioner or should just be seeing a nurse. And so our mental health system isn't as efficient still at this point in being able to help to get people to that right door. And so oftentimes that's where families and others are frustrated. So that's where we have a role as a community in helping to support individuals and create safe places. Because if we do that, then there's probably a certain percentage of people that will never need to go see a professional or never need medication management. And that's really what NAMI does. NAMI does a great job of creating connection and support in a way that's community-based and grassroots. And that's really what Mental Health First Aid is all about, is what is your role as a community? Not all these issues are gonna be fixed by the system, whatever the system is, and the professionals up here. This is a community issue. Stigma is about the way we view emotional health in the community. And so, as we step back and look at what's wrong with the system, we have to take a look in the mirror individually and have conversations about how can we move forward and how can we do that in a way that's engaging, that reflects the uniqueness of every person and what each one of these professionals can do in their specialties and what they bring to the table.
One thing I'd encourage everyone to do as individuals, and one way that I believe individuals can help, is simply asking those around you, are you okay? And it's not just asking once, but it's asking repeatedly, because the more you ask, the more vulnerable they're going to be, instead of just saying, oh, I'm fine, saying, you know what, I'm actually having a rough day. So it's a small level, but if we continue to check in on those around us, simply asking, are you okay, can be really powerful.
Okay, I'm really excited because we have our first question that came in from one of our online viewers. So here we go. How can I cope with an emotionally unstable partner who has anxiety disorder?
Here's that connection. She's nailed, whoever's there, you've nailed it on the head. Mental health condition does not just affect the person with the mental health condition. It affects everyone who cares for that person. So I guess my recommendation is how do you handle it would be to take care of you and maybe connect to, we have a family support group, and family support group allows you to release all those things off your chest, and you will hear from others that they too have experienced the same thing, and then what they've found that helps is, they're not giving suggestions, but it's just what works for different people. So I really recommend support. I also recommend our family to family class. We have one going on, and I won't identify unless they want, but we have an individual in the audience who is actually teaching one of our family to family classes right now. And that class is so amazing because you learn communication skills, you learn how to better advocate for your loved one, as well as really understanding what is happening in the brain and separating what is going on with the brain and neurotransmitters and everything to the person. It helps you to try to separate those. I can't say enough about that class. That's actually how my husband and I got involved with NAMI, was taking the family to family class. And therapy.
I also have a question from someone. What are the concerns that you as providers are seeing in our community And are you seeing an influx of people coming in to your agencies and calls?
Yeah, so I can just start with that. So I think we experienced kind of that lull, like Jason was talking about, where people might have been on autopilot or just kind of in that survival mode for COVID. So during the initial pandemic, we saw a very significant decrease in calls. I think those people went into that survival mode and they were just really trying to get by. So now that we are restructuring and recovering and trying to figure out how to get back to that baseline, we have seen a significant increase in calls. I think those individuals are starting to process more, looking back, thinking what happened. That was really difficult, and maybe they're experiencing some ongoing struggles as well. So we have seen an increase across the board from the beginning of the pandemic until now, and it continues to go up. We've also had conversations with hospitals recently who have reached out to us saying they're extremely overwhelmed. How can we assist? So we continuously encourage individuals to call our crisis line. Prevention really is key. So I know we've talked a lot about those connections prior and learning those warning signs. So really introducing those services prior has the best long-term effects. So I know we've touched a lot on that, but we really are seeing that at the forefront. We've also seen a lot of increase in those youth calls as well as family calls. We've arrived to a lot of families who we really are acting as those mediators, and it's not that one person's right and one's wrong. It's really everyone's experiencing different perspectives. Maybe the kid, is going through very much of a change at school. They're trying to adapt. They're isolating because they can't speak to their friends as much in person. The mom, might be stressed out because she's also trying to figure out technology. So all of those stressors surrounding it, and we can kind of come in and mediate and be that middleman to say, it's okay that everyone is feeling this way. It's okay that the child is upset because they can't see their friends. It's okay that the mom is stressed because, we've all experienced technology and it's just not fun. So across the board, just having an outsider come in, involving the community, involving those other mental health professionals really can be key up front.
At NAMI Central Iowa, through the pandemic, we typically serve 9 to 11 counties, however I want to say it, Carla, in the mental health region. And we started receiving calls from all over Iowa. And when I went into actually mapping all of our counties, so we normally serve 11, we actually served individuals in 31 counties in the state of Iowa. And so when we have 99 counties and we are helping people in 31 of them, we had a definite increase in services needed. And a blessing, a silver lining, Zoom was wonderful. So we ended up adding support groups so that individuals could do that. And we also added a working professional support group for those who are in the workplace and experiencing maybe anxiety or depression for the first time.
Just want to give some statistics from Ames Police Department. Just this last year, there were over 2,000 mental health calls for service, and I responded to about 1,500 of those calls. That is not including our Iowa State students. Kinsey, I don't know if you can speak to that, but I know there's a lot of students that you work with. I also can say that over 2,000 incidents, I'm sure there's so many more that did not come my way. So there are a lot of people that are struggling.
Yeah, just to give you a few statistics on our welfare checks. In 2015, we had 191 calls for welfare checks, and that is just students that are on campus or living in campus housing. Ames PD has the other students in their jurisdiction. So 2015, 191 calls. In 2019, we had 326. From 2015 to 2019, we just saw those numbers increase drastically. In 2020, we had a little dip because of COVID. We went down to about 280 calls for welfare checks, but that was with students only with us for about half of the year. So now with students being back full-time in the fall and this past spring, we've seen definitely an increase of welfare checks for sure. We've seen an increase of suicide attempts and also a lot of people self-medicating.
Any other questions or comments you have for the panel? You know, I've lived and worked in Ames and Story County now for over 30 years, and events like this have always touched me because not only do we have such a great set of services that are available within our community, but all of you and those who are online who joined tonight to recognize the importance of mental health and disability services, and now more times than ever. And I think we are really scratching that surface of digging away at the stigma. We have more and more people who are willing to talk about this, talk about their own experiences. That's how we learn a lot from each other. So I want to just thank everyone for sharing and for asking questions. I'm going to turn it back over to the mayor if he would like to come up and provide some information about the next steps in our initiative and give some parting thoughts.
Well, first of all, how about a round of applause for our panelists? Thank you very much. I mentioned at the onset that we were going to do some education. Thank you, Jason. And honestly, I've been thinking a lot about one of the points you made, and that was, to me, conventional wisdom is if we were at 11%, when you said in the chart, you know, and then we've gone up as high as 46%, I have to say I thought, well, we'll just go back down to 11%. But the point is it's not going to happen. And so the point is we need resources like the panelists up here, and we need education, and we need to be talking about it. So thank you for that. We've also heard about, we talked about educating and assisting, and now I'm excited to share about a opportunity that our city council has agreed to fund, and it's called Mental Health First Aid, and I noticed the symbol that you had on your slide. Typically, these classes are very expensive, which includes materials, and City Council has, and in concert with Kenzie, right, and Julie, that training will be offered for free to the community members, and Council has committed $5,000 to help pay for the materials, and they made it very clear if that wasn't adequate, come back and ask for more money. We want to get our arms wrapped around and get a real handle on this before it turns into a major epidemic. So the training is going to help people acquire basic knowledge and skills on how to recognize and respond to individuals with mental health distress. We heard about identifying symptoms. This is not training everyone to be counselors. This is going to give you some good practical information. And I just saw the cover of the handbook, and it's about that thick, I believe. And in fact, Julie just finished doing some training with department heads, and I don't know if it's going to be 8 hours long or not, but the point is that it's not just a half an hour session. But if you are, how are we going to do that? Is that everyone on the signed up could why don't you talk about that for a second, how they can. Wasn't well rehearsed.
That's all right. So if you're interested in learning or getting more information about mental health first aid training, we do have sign-up sheets in the foyer. So if you haven't signed up before you leave tonight, please do that. And we'll get information out to you then when we've got dates confirmed. We're going to try and offer it throughout the summer. So if the first set of dates doesn't work for you, maybe the next set or so will, but please sign up tonight. Also be watching the city's website for more information, as well as our social media platforms.
Excuse me, tell us at this point, are these daytime sessions, or are they like 2 hours for 4 weeks, or nighttime sessions?
Okay, so the question is when the sessions will be offered, and I'll let Julie speak to that since she's taking the lead on it.
Yeah, we want to make this available to everybody and, and their schedules, of course. So right now, we're looking at 2 days that would be 4 hours each. We'll kind of break that up for folks. I don't know yet if it's going to be in the morning, in the afternoon, or the evening. We can certainly do all of that. And then we will have a day that is going to be 8 hours. I know that's long, but for some folks, that works for them. So as soon as we know those dates, we'll put that out there, and I think we're going to try to accommodate everybody is the goal.
And for those of you who may be watching online, if you go to our City of Ames website, there'll be an opportunity to indicate interest also. If you can't find it, you can go ahead and email me. Just go to the mayor and city council email address and say you watch, you want to find information, and we'll get you hooked up. So we're also looking at potentially offering some suicide prevention training to interested community members. That's being looked into. That's not been committed to yet. The other thing I want to mention too is that, as I mentioned before, this is just a start. We're going to have the training during the summer, but in the fall we're going to have a mental health expo, which is scheduled right now for September 21st, and the keynote speaker is Kevin Hines, and some of you may have heard about him, but he attempted suicide by jumping off of the Golden Gate Bridge, and he's only one of 36 individuals who survived. And it's my understanding that his message is compelling, offers hope and insight to his listeners. So people I've talked to are extremely excited about him coming, or maybe coming. Is it going to be virtual? Seeing him on screen, how's that? So anyway, tonight took a lot of work to put together, and I just want to thank several of the city staff members. First of all, Julie Saxon and Deb really took this when I said, hey, let's do a mental health forum about a month ago, and they just really got into it. So thank you very much for your efforts. And Susan Guiazda, who's our public information officer, Craig Kaufman, who's behind the curtain like Wizard of Oz, Andrea Cardenas, Kate Barbalinga, and Courtney Hinders have all participated too. So a lot of times people are behind the scenes, don't get recognition, but I just want to say thank you because this couldn't have happened without their help. So. And to close, I just want to thank you for the privilege of your time. I trust this has been informative and helpful, as well as offering some hope. As a community, we need to work together to proactively address this pending crisis, remove the stigma, and assist those who are dealing with mental health issues. I think that a lot of times, again, we're not aware of what the outcome are. I know there has been aware of suicides on campus, suicide attempts, suicide ideations. It's hard to talk about. I don't want to be necessarily a Debbie Downer. But the point is, I'd rather talk about it now and say, what can we do to try and help people before it gets to that point? But I've just been really encouraged to hear of all the resources that are here right now. I think it's safe to say, I think everyone would agree, we are seeing increased mental health issues. We just need to get our arms around it. And I think because of you coming out, that's a good start. And please tell people about this. And also it is being archived online. And we'll just keep the conversation going. So with that, thank you very much for coming and enjoy the rest of your evening.